Idiosyncrasy is a type B of adverse drug reactions. The therapeutic index of drug is the measure of its safety. Ergot alkaloid has a therapeutic benefit in Alzheimer's disease is dihydroergotoxin. Which of the following statement is correct? Liver is bypassed by sublingual route. The advantage of combination of levodopa with carbidopa is that decreases the half-life of levodopa. Benzodiazepine failed to exert the therapeutic uses in the neurodegenerative diseases. Receptors perform the following functions: ligand recognition and signal transduction. If the effect of the combination of two drugs is equal to the sum of their individual effects, the two drugs exhibit synergism. Lantoprot is used in the treatment of glaucoma. As you all know, it is a prostaglandin analog. The drawback of nitrous oxide is anesthetic agent in it may lead to diffusion hypoxia. Incompatibility with other anesthetic agents is sorry. Huh. The morphine exerts meiosis effect. That was option. The most unwanted stage of anesthesia which can be escaped with new anesthetic agents is the stage of delirium. An example of depolarizing blocker is your succinylcholine. Others are your non-depolarizing agents. The drug useful in Parkinson's disease is the levodopa, which is a dopamine precursor. Which of the following is a nuclear receptor? Glucocorticoid receptor. An example of CNS stimulant drug is your amphetamine. Fetal hydantoin syndrome is an adverse effect of phenytoin. Hydantoin, phenytoin. Remember like this. Which of the following is a G protein coupled receptor? Muscarinic cholinergic receptor. Which of the following statement is correct from this? High hydrophilic drugs can cross the blood-brain barrier. Acidic drugs remain in unionized form from the basic pH or absorption of it is this absorption of SC site from is lower than subcutaneous site is lower than that of the intramuscular site. The mechanism of disulfiram of alcohol absentase is aldehyde dehydrogenation inhibition. Glutathione conjugation detoxifies which of the following drug? Paracetamol. Carvedil- Carvedilol is an example of alpha plus beta. It is a mixed drug, right? Thiopentanol is which? It is an ultra short acting drug. The following is a selective 5-HT4 agonist. Buziprone. Typical antipsychotics are preferred over typical antipsychotics mainly because they show minimal extrapyramidal side effect. The following receptor type has 7 helical members spanning 2 amino acid segments. It is a metabotropic receptor or your first receptor, that is the G protein coupled receptor. Pharmacokinetics is a study of what body does to the drug, and what drug does to the body is a pharmacodynamic. So what is kinetics? What body does to the drug. Gabapentin acts by enhancing the GABA release. Dry, flushed and hot skin, dry or dilated pupil, photophobia and dry mouth, excitement, convulsions and coma are manifestation of belladonna poisoning. Which of the following statement is correct for atropine? It is specific antidote for anticholinesterase poisoning. Downregulation of receptors can occur as a consequence in the continuous use of agonist. Monoamine oxidase B subtype cause oxidation of phenylethylamine. Which of the following statement is correct for neuromuscular blocking agents? Produces respiratory paralysis and prolonged aponia. Essential medicines are those which have satisfaction for the priority healthcare needs of the population. Which of the following statement is correct for microsomal enzyme induction? Synthesis of enzyme is increased. Which of the following statement is correct? Larger fibers are more sensitive to local anesthetic actions. Local anesthetic often affords adequate pain control in the inflamed tissues. Local anesthetics produce a sequence of depression followed by stimulation, or it acts by stabilizing sodium channel in activated state is the correct answer. Side effect of serotonin reuptake inhibitors include the sexual dysfunction. A partial agonist can antagonize the effects of full agonist because it has a high affinity but low intrinsic activity. Drugs that have attained high concentration in bile include ampicillin. The only LA capable of antisizing intact skin is eutatic lidocaine or prilocaine. Thank you everyone. Hope this helps.